Good afternoon, everyone. Again, my name is Montserrat Reimann, and today we will continue with another lecture, and this is called The Nose and the Paranasal Sinuses. So the following are the learning objectives from your worksheet. So after this lecture, you should be able to gain the basis to continue on your own study, to be able to achieve what is written here. So to identify and locate the nasal cavities and paranasal sinuses and their bony relations and appreciate their functional and clinical relevance. Describe the drainage of the paranasal sinuses in normal and in diseased states. Describe the boundaries, contents, and communications of the nasal cavities and paranasal sinuses. Describe the nasopharynx and its communications. Identify the tissues of the nose, paranasal air sinuses, and the nasopharynx on models, bones, and using imaging methods such as plain film radiographs, MRI, and CT scans, and appreciate the anatomical continuity of the upper respiratory tract and the auditory tube. Well, at the end as well, I have included different studies, so we will be able to appreciate the clinical relevance of this topic. We will begin with the nose, which is part of the respiratory tract that contains the peripheral organ of the smell. It includes the external nose and the nasal cavity. So the external nose is the visible portion that projects from the face. It's a skeleton, it's mainly cartilaginous, and then the supporting skeleton of the nose is composed of a part that has bones and the hyaline cartilage. So the bony part of the nose will consist of the nasal bones and the frontal process of the maxilla here, then the nasal part of the frontal bone, this one, and also the bony parts of the nasal septum that we will see later on, and the cartilaginous part of the nose, this bit here, it's made of 5 main cartilages. Two of them are the lateral cartilage, and then we have 2 alar cartilage that we can see here, and one is the septal cartilage, which is this one. The alar cartilage has like U shape that is free and movable and can dilate or constrict when the nares can dilate or constrict the nares when the muscles acting on the nose will contract. So the nasal cavity is located superior to the hard palate, and it's divided into the right and left cavities by this structure that is the nasal septum. Then it opens posteriorly here into the nasopharynx through the choana. So the choana is like the synonym of the posterior opening. So let's see, the location of it will be the front part of the cranial cavity, and specifically the anterior cranial fossa, will lie above it. The hard palate is immediately inferior to the nasal cavity. The choana, as we said, will be the so the nasal cavity extends from the vestibule, which is here, to the nasopharynx and has three divisions. The vestibule, which is located more anterior, and this area that is surrounding the anterior external opening of the nasal cavity is lined with skin and not nasal mucosa. So this is stratified and keratin, squamous epithelium. And then we have this respiratory region. This one is lined by the typical epithelium located in the respiratory tract, which is the ciliated pseudostratified columnar epithelium. And then, well, this one will be interspersed with mucus secreting goblet cells. And this is characteristic of the upper respiratory. We will have to remember that this pseudostratified epithelium with goblet cells, it's part of or will be lining the nostrils, the nasal cavities, the paranasal sinuses, mouth, pharynx, and larynx. But there is part of the respiratory tract that differs from the upper respiratory. And also remember, for example, the alveoli, which is simple squamous epithelium, to allow the exchange of gases. And we also have this portion here with olfactory epithelium, and this is the olfactory region. So it's located in the apex of the nasal cavity, and this one is lined by olfactory cells with olfactory receptors. So this part will be lined with a specialized mucosa that will contain the peripheral organ of smell and will contain the neurons. So the central processes of the olfactory receptors of neurons that are located in the olfactory epithelium will unite here, and then these neurons will form a nerve or nerve bundles that will pass through the cribriform plate of the ethmoid and will enter the olfactory bulb of the olfactory nerve, which is cranial nerve number 1, and will be lying. And the nasal mucosa, which is the mucosa that is lining these nasal cavities, is firmly attached to these bony structures or periosteum and also the perichondrium of the bones and the cartilage of the nose, with the exception of the vestibule, which is lined with skin, as we said before. And then this mucosa is continuous with the chambers that will communicate with the nasopharynx posteriorly, the paranasal sinuses superiorly, for example, here the frontal sinus, and laterally with the maxilla. Now, if we consider the functions of the nose, this will include olfaction or smelling, respiration or breathing, filtration of dust, humidification of inspired air, and reception and elimination of secretions from the paranasal sinuses and also the nasolacrimal ducts. So which are the boundaries of this nasal cavity? Whenever we talk about a cavity and we want to describe the boundaries, we have to imagine this cavity as a room that has different walls, anterior, medial, posterior, etc., that will contain different structures. So, for example, in this case, we will talk about the nasal cavity. We need to consider the roof that I have shaded or marked here in light blue. So the roof is made of nasal and also the frontal bone. And then posteriorly, we have this structure, which is the cribriform plate of the ethmoid. And in the most posterior aspect, we have the body of the sphenoid. Then the floor is this hard palate that we know that will separate the nasal cavity with the oral cavity, is made of the palatine process of the maxilla and also the horizontal plate of the palatine bone. The medial wall that we cannot see here, as this is a sagittal section, and we're looking at the lateral wall of the nasal cavity. So the middle wall is made of the nasal septum that we will see later. And the lateral wall is made of the superior, middle, and inferior nasal concha, and also the meatus that are in relation to them. Anteriorly, we have the anterior opening on nares, and posteriorly, we have the posterior opening or the choana that will open into the nasopharynx. So the lateral wall, this one, is made of the superior, this one here, middle, and inferior nasal concha. The superior and the middle one are part of the ethmoid bone, so that is why they look or they have the same color here. Whereas the inferior nasal concha is a complete separate bone. Inferior to the nasal concha or to each nasal concha, we will find recesses or spaces that are called meatus. So we will have inferior to the superior nasal concha, the superior meatus, then inferior to the middle nasal concha, the middle meatus, and inferior to the inferior nasal concha, the inferior meatus. Which are the functions of this nasal concha or turbinates? They are to disturb the airflow and will make it more turbulent, to reduce the speed of the airflow that is entering here, and also kind of throw the cavity into folds and increase the surface area. So the air that is entering here will have to spend more time in the nasal cavity. If there is dry air that is entering here, it will get humidified. Then if this air is cold, it will be warmed here because of the body temperature and the mucosa that is covering these bone structures. The dust particles in air will be filtered by the cilia, and the bacteria as well is filtered out. So in this case, we have a dissection, and what we can see is a sagittal section, and we are looking at the lateral wall. So we can see the nasal concha covered by mucosa. So here we have superior, middle, and inferior nasal concha, and also the superior nasal meatus there. And then here we have the middle nasal meatus, and here the inferior nasal meatus. These two diagrams have been taken from Complete Anatomy, and it may look a bit complicated, but what are the structures that we need to discriminate? Here we have the hard palate. So this will be the nasal cavity, but I have removed some of the bones to kind of make it easier to understand how is the lateral wall of the nasal cavity. But if you look on your own in Complete Anatomy and you start removing the bones and rotating these walls, you will get to the same as we have here. So in this left side, we have the right inferior nasal concha, but from a lateral view. And in this right side, here we have the ethmoid bone, as well from the lateral view. And you can see how this one is articulating with the inferior nasal concha. Now, this is the way the medial wall of the nasal cavity looks like. So it's absolutely different to the lateral wall. And how can we recognize the medial wall or differentiate the medial wall to the lateral wall? The medial wall is like this. It's very plain, boring, whereas the lateral wall has those turbinator concha making it, so they are absolutely different. Now, this medial wall of the nasal cavity will be formed by this nasal septum, and this nasal septum will be covered by mucosa that is firmly attached to the periosteum and also the perichondrium here in the septal cartilage. So which are the components of the nasal septum? We have the perpendicular plate of the ethmoid here, posterior superiorly, the vomer bone, posterior inferiorly. We also have here inferiorly the crest of the palatine bone, the crest of the maxillary bone, and the anterior 1/3 of the nasal septum is made of this septal cartilage, which has cartilaginous and also hyaline cartilage. And in this picture here, as we cannot see the concha, we can deduce that this one is the medial wall of the nasal cavity. So this is a dissection of this wall. So the nasal septum is made of the perpendicular plate of the ethmoid, the vomer, and the septal cartilage, but in this case they are covered by mucosa. Now, this is a frontal view of the skull, and we can see how does the nasal septum looks from a frontal view. The nasal cavity will have this pyramidal shape, So we can see as well this big inferior nasal concha. So always remember that the conchas are located in the lateral wall, whereas the nasal septum is making the medial wall of the nasal cavity. And here we have the same that we saw before, but again from kind of anterolateral view. So this is more anteriorly, but I have rotated this view to the lateral. So we can see here which are the bones that are making the septum. Superiorly then, the perpendicular plate of the ethmoid. So you can see the ethmoid bone here and the perpendicular plate superiorly. And inferiorly, we have the vomer. So we have the same here, superiorly the ethmoid bone and inferiorly the vomer. Remember that this space will be occupied by the septal cartilage.